Mr Deputy Speaker. It's a great pleasure to follow my honourable friend, the member for Banbury, and I begin by congratulating my honourable friend, the member for Wellingborough, for his hard work in bringing this bill through the House, and commend him for steering it through the committee unamended, which I think reflects the importance which the whole House holds this topic. Mr Deputy Speaker, as my honourable friend mentioned, the National Data Guardian, Dame Fiona Caldicott, has already done much work in promoting good practicing and handling medical data, and I'm sure that putting her role on a statutory footing will only enhance this further. And I want to join my honourable friend, the member for Banbury, and others in paying tribute to the work of Dame Fiona, who has played an excellent role and been a strong voice for patients as the first National Data Guardian. I'm particularly pleased to speak in this debate because of my long-standing interest in the fourth industrial revolution, and also because of the report that I recently released, which was supported by my right honourable friend, the Secretary of State for Health and Social Care, about how we can better use technology and data to improve the performance of the NHS. And as we reflect in this week, when we celebrate the 70th anniversary of the NHS, I think there is no more apt time to not only look back at the success of the NHS, but also to look forward about how we can safeguard its future through the use of good data. But, Mr Deputy Speaker, we should remember that even in its infancy, in 1954, the NHS has been a long-standing user of good data. And in the 1950s, it was data from 20 London hospitals that first proved the link between smoking and lung cancer, and which certainly saved a lot of lives in the years hence. So let us fast forward to 2018, and the potential for using medical data to improve lives has certainly grown exponentially. But despite the clear and unquestioned potential of the fourth industrial revolution and the new technologies associated with it, it is true that many in the public still remain sceptical about its benefits. They, like myself, have seen a number of attempts at digitising health services fail, from the National Programme of IT under the last Labour government to the WannaCry hack last year. There's still much work to do to win over a sceptical public. And that's why my argument is clear and my support for this bill is clear, because I believe that shared data saves lives, and I believe that the National Data Guardian has an important role to play in spreading this message. One of the three principles of the National Data Guardian is building a dialogue with the public about how we all wish information about ourselves to be used. And while the NHS is rightly bringing about a wide range of digital services, I have no doubt the service most coveted by patients and our constituents, those in the smartphone generation in particular, is the long-awaited NHS smartphone app. Anyone that has used NHS digital services will know that there's a wide variety of options available to patients. And one of the key recommendations in my report was that the NHS introduces a one-stop shop, an overarching app that would allow patients across the whole of England to book an appointment, order repeat prescriptions, control access to data, and seek advice on medical problems. It would be an app that operates on a 24/7 basis, so patients could have access to the NHS at their fingertips from the comfort of their sofa or their desk or their place of work. Because my long-term vision is for a smart NHS that personalises medicine, personalises treatment, and provides advice in one integrated place. And that's why I was delighted that the Secretary of State recently announced that he will be taking forward plans to build this new NHS app to make sure that the smartphone generation has access to healthcare at their fingertips. So as the Secretary of State and the Minister and his colleagues at the Department of Health and Social Care begin the work of designing and implementing this app, I think the National Data Guardian can play an important role in shaping its future. She should push and call for full integration of the app with paperless records to make sure that digitisation takes place throughout the whole of the NHS. It's only through making sure that this app is available to everybody that the NHS can reach its full potential, delivering all the services that I envisioned in my report. So, Mr Deputy Speaker, to conclude, the healthcare of tomorrow will be powered by artificial intelligence, big data, automation and increasing digital connectivity, and that's why the NHS must be a global leader in this field. But at the same time, we must ensure that informed consent is not put at risk and the patient voice is kept at the heart of all treatment. Key to this is the role of the National Data Guardian, and that's why I'm very keen to see her role placed on a statutory footing, and that's why I'm delighted to support the bill today.